In this personal injury presentation, our medical team will share the 4 categories of documentation necessary to win a policy limit award for the soft tissue spinal injury claim and the financial drivers required to stop lowball offers. The top 4 categories of documentation include the top 5 financial drivers of Colossus Injury Award software, the 4 pillars of documentation necessary to win large awards, how to defend the pre-existing injury and the low-impact injury with low property damage, and the financial claim worksheet that converts documentation into the 4 injury award categories to support a policy limit award. The 4 injury award categories supported by our medical team documentation includes all medical diagnostics and treatment, the pain and suffering category, the permanent injury and impairment rating category, and the need for future care category. Let's start with how our medical team documentation supports the 4 major injury award categories for your client's soft tissue spinal injury claim for policy limits. Then let's move into the insurance adjuster's top 5 financial drivers of injury award software such as Colossus. In addition, we'll share 3 strategies attorneys can use to immediately stop lowball offers. We will also disclose how our documentation defends against the insurance adjuster's 2 arguments to minimize their financial liability and reduce your injury award. The 2 common insurance arguments are the pre-existing injury argument and the low-impact injury argument with low property damage. Then we will end with our financial claim worksheet and show exactly how our documentation converts the 4 major injury claim categories into a policy limit award. The following are the exact steps used by our medical team to document the financial drivers of a soft tissue spinal injury to support your injury claim for policy limits. Our medical team documentation is the same documentation that is trained by the world's largest chiropractic provider and used in every state, supporting thousands of soft tissue spinal injury awards. So let's start with the 4 major injury award categories and how our medical team documentation supports the soft tissue spinal injury claim for policy limits. The following are the 4 major injury award categories our medical team documentation supports. The first category is all medical diagnostics and treatment. The second category is the pain and suffering injury award category. The third injury award category is permanent injury and impairments. And the 4th injury award category is the need for future care. Each individual award category will not create a policy limit award. However, when you total each of the 4 categories, it will support a policy limit award. Then we will show how to convert our documentation into the financial claims worksheet and convert all 4 injury award categories, which will total a policy limit award. So the first category is the medical documentation necessary, which includes the mechanism of injury and the cause and effect relationship, a combination of subjective and objective findings, the patient's response to treatment, all permanent injury impairment ratings, and the need for future care. And the second injury award category is the pain and suffering documentation, and the necessary documentation includes SOAP notes and pain diagrams, activities of daily living indexes, functional capacity indexes, loss of enjoyment of lifetime activities indexes, and duties under duress indexes. Now, the third injury award category is the permanent injury and impairment rating category. And the documentation necessary includes totally objective diagnostics, maximum medical improvement determination, documentation based on the science of the 3 phases of healing, and impairments based on the AMA guides to impairments. Now, the 4th category, and this is typically the largest financial award category, is the need for future care documentation. Now, what is needed to establish the need for future care is the treatment needed for symptom care, the frequency of treatment, the cost of treatment, the patient's age, and the life expectancy. Now, in addition, our medical team documentation supports common awards such as medical-related expenses, missed work or other lost income, loss of family, social, and educational experiences, even emotional damages resulting from any of the above. And our documentation supports special damages, such as the more painful the injury, the more invasive the treatment, the longer the recovery period, or even visible permanent injuries. Doctors who do not document all the financial drivers will limit all 4 injury claim categories and significantly reduce your potential injury award. As you know, the personal injury attorney award will typically be determined by one of 2 methods, the insurance adjuster or a trial by jury. The good news is, with our documentation, the attorney can maximize the adjuster's injury award software or bypass their lowball offers and allow an objective jury to fully award the claim. In this presentation, we will share with you the documentation necessary for both, how to maximize the adjuster's injury award software, and if they continue to lowball your claim, the documentation necessary to win a jury verdict. Either way, our medical team documentation will enable you to negotiate with the insurance adjuster from a position of strength. So let's get started with how to maximize the soft tissue spinal injury award by way of the insurance adjuster. I'm sure you know over 80% of auto insurers use some form of claims processing software for determining compensation for soft tissue spinal injuries. The vast majority use the Big Four, which are Colossus, Claims Outcome Advisor, Injury Claims Evaluator, and Injury IQ. The reason auto insurance turned to injury award software programs is over 80% of soft tissue spinal injuries show the same 5 major financial driver categories. They also save millions of dollars by lowballing attorneys' claims who do not have the documentation necessary to support all 5 major financial driver categories. The primary support for Colossus Injury Award software is from the doctor's notes, reports, and narratives. The good news is a doctor who documents all 5 major financial driver categories is the single most important part of Colossus and support for your soft tissue spinal injury claim. The bad news are doctors who do not document all 5 major financial driver categories will force you to accept lowball offers, costing you thousands of dollars per case. Our financial claim worksheet shows how attorneys who process only 2 claims per month lose on average over $200,000 a year. And this is due to the doctors neglecting to document many of the financial driver categories. So let's get started with the top 5 financial driver categories of Colossus for the soft tissue spinal injury award. This documentation also includes how to stop lowball offers and the 4 pillars of documentation necessary to support large awards. These are the top 5 financial value drivers for a soft tissue spinal injury award based on Colossus and injury award software. The number 1 and highest award is the injury category or the diagnosis category. The second highest is the impairment rating category. And the third is the loss of enjoyment of lifetime activities. And the 4th is duties under duress restrictions. And the 5th is the permanent injury and the need for future care. Now, according to the Insurance Research Council, these are the top 5 injuries and percentage of occurrence. So the soft tissue injury is at 87%. The disc injury is only 32%. The nerve injury is only 16%, and the mild concussion is only 10%, and broken bones and fractures are only 2%. We can draw one major conclusion from the Insurance Research Council's data. Your client's doctors should know how to document all 5 financial driver categories for the soft tissue spinal injury, or you will have to continually settle for lowball offers. Let's start with how our medical team documents the top 5 financial drivers to support your soft tissue spinal injury claim for policy limits. The number one and highest financial drivers are the injury and diagnosis category. Now, the number one soft tissue spinal injury, and this is based on the Insurance Research Council, is alteration of motion segment integrity, or AOMSI. AOMSI is when the spinal bones become pathologically restricted or there's an anatomical failure in the ligaments which alters spinal joint motion. We now have 100% objective evidence for the verification of soft tissue spinal injuries using medically accepted diagnostics. Dynamic motion X-rays are the diagnostic tool to document and measure the AOMSI injury. The magnitude of the AOMSI diagnosis cannot be understated. It is the precursor to spinal arthritis, and arthritis is the number one disability in the United States. Unfortunately, many doctors, and therefore by extension, personal injury attorneys, have never heard of alteration of motion segment integrity. Medical doctors often omit the necessary diagnostics because they are trained in the diagnostics of organic disease and not the pathology of altered spinal biomechanics. When the AOMSI diagnostic tests are not included, you will be missing the number one and highest financial driver for your soft tissue spinal injury award. The documentation of alteration of motion segment integrity is the single most prevalent and valuable soft tissue spinal injury diagnosis to support your soft tissue injury award. This is an example of the prevalence and value comparing the disc injury to the AOMSI injury. The disc injury occurs in only 32% of injuries and gives a 6% impairment. The AOMSI injury occurs in 87% of injuries and gives a 25% impairment. Therefore, if AOMSI is not documented, your injury claim will lack the most prevalent and highest financial value driver, resulting in potentially losing tens of thousands of dollars per case. The documentation of AOMSI is important for 3 reasons. The first reason is, according to the Insurance Research Council's data, it's the largest injury by volume at 87%, which also means 68% of the injuries will not have a disc component. 84% of the injuries will not have a nerve component. 90% of the injuries will not have a mild concussion, and 92% will not have a broken bone. And so if your client's doctors have not documented the soft tissue spinal injury of AOMSI, you will be missing out on 87% of the injuries and their corresponding financial award. It gets worse. Not having the documentation for the number one auto injury will also eliminate the next 4 financial driver categories, leaving you with little documentation to support your injury claim. A classic example is when the doctor's notes only gives the diagnosis of a cervical sprain strain, a negative MRI, and maybe months of treatment and a large bill. In this example, you will not have the documentation necessary to support your injury demand. You will be at the mercy of the insurance adjusters and continue to get lowball offers. And you will always have to plead with the client's doctors to reduce their bill due to small awards. The second reason it is important to document AOMSI is due to the fact that impairments are the second highest financial value driver category after the injury diagnosis. The impairment rating for alteration of motion segment integrity offers a 25% whole body impairment, and this is based on the American Medical Association Guides to Impairment. The AMA Guides to Impairment is the industry standard that offers significant credibility to support your injury claim. Now, the third reason AOMSI should be documented is if your client also has a spinal disc bulge, peripheral nerve injury, or mild concussion. When you combine the disc bulge, the nerve injury, or a mild concussion with the ALMSI injury, you have potentially doubled the financial value of the case. If a patient has suffered a disc bulge, nerve injury, or mild concussion, they almost certainly will have suffered the ALMSI injury. Attorneys who only submit a disc bulge, nerve injury, or mild concussion without the ALMSI diagnosis injury will almost certainly lose hundreds of thousands of dollars per year, depending on your case volume. You can see the value adds up quickly when working with our medical team who understands and documents the financial drivers of the ALMSI injury, especially when combining it to the disc or nerve injury. Now let's go to the third and fourth highest financial value driver categories, which are loss of enjoyment of lifetime activities and duties under duress. These two documents help to establish the loss of activities of daily living or painful restrictions with those activities. These are some of the ways loss of enjoyment of lifetime activities and duties under duress will support your injury claim. Missed work or lost income, limitations in activities such as bathing or dressing, restrictions in cooking, cleaning, or laundry, loss of family, social, and educational experiences. The key to documenting loss of enjoyment of lifetime activities and duties under duress is to document all three joint motions. Each spinal joint has three ranges of motion: an active motion, a passive motion, and joint motion. Most soft tissue spinal injuries will have normal active range of motion upon completion of therapy, but will have abnormal overpressure and joint motion. Unfortunately, most doctors only document active range of motion and not overpressure or joint motion. An example of overpressure and joint motion are when clients can move fully, yet have pain and restrictions when they bend, twist, or turn during daily activities. Unfortunately for the client, if this injury heals wrong, it is the leading cause of arthritis and the #1 disability in the United States. The good news for your injury award is if the doctor documented the painful overpressure and restricted joint motion along with ALMSI, it will support a large financial award. However, not documenting joint overpressure and joint motion will limit the financial award for the third and fourth highest financial value drivers of injury award software such as Colossus. And when the soft tissue spinal injury documentation continually lacks the financial drivers of Colossus, you will regularly be forced to accept lowball offers. I'll share with you a common soft tissue spinal injury case that went from the insurance company's no offer to a jury awarding her policy limits of $110,000. The basics of the case include a mother suffered the ALMSI soft tissue spinal injury. There were no other injuries such as a disc or nerve injury. Her medical doctor documented normal active range of motion. Painful joint motion prevented her from picking up her daughter. The lack of documentation is what resulted in no offer from the insurance company. Therefore, the case was presented before a jury. Now, the chiropractor took the same case and documented the soft tissue spinal injury, ALMSI, and they did it with motion x-rays. Gave the ALMSI injury an impairment rating based on the AMA guides, documented the loss of enjoyment of lifetime activities, joint overpressure, and documented her duties under duress, joint motion. Supported the need for future care based on the 3 phases of healing. Now, this is the difference documentation makes with soft tissue spinal injuries and their awards. Her medical doctor documented 0 of the top 5 financial value driver categories, and this is why the insurance company offered her nothing. The chiropractor documented all 5 financial driver categories and was able to show and explain them to a jury. Her soft tissue spinal injury went from the insurance company offering her nothing to a jury awarding her policy limits of $110,000. And so if your client's doctors are not testing for overpressure and joint motion, along with the LMSI injury and giving impairment ratings, you will lack all 5 of the major financial driver categories. A question becomes, how long are you willing to accept the lack of documentation for all 5 major financial value driver categories to support your injury claim? Now, the 5th and one of the most lucrative financial drivers is the documentation of maximum medical improvement and the need for future care. A permanent injury and the need for future care is the single greatest financial driver for soft tissue spinal injury awards. The need for future care formula will depend on your client's age and the medical costs associated with treating their permanent injury for life. The ability to justify the need for future care is dependent on the doctor's ability to document 2 factors. The first factor is the doctor's ability to determine the injury has reached maximum medical improvement based on the industry standard AMA guides to impairment. Now, the second factor is the doctor's ability to explain in his narrative, deposition, or to a jury 3 factors. Number 1 is how to objectively show the LMSI injury. Number 2 is how he arrived at a permanent impairment rating. And number 3 is why the patient needs care the rest of their life based on the science of the 3 phases of healing. Our medical team documentation supports and justifies the need for future care by multiplying 4 factors: the treatment needed for symptom care, the treatment frequency, the treatment cost, and the difference between the patient's age and life expectancy. This is an example of how to calculate the need for future care. So if we were to take a 32-year-old male with a permanent LMSI injury, the cost for chiropractic physical medicine would be $50. The cost for active stretching therapy would be $40. Symptom care frequency would be established maybe at one time every 2 weeks with a life expectancy of 82. We would multiply all the relevant factors, 50 years life expectancy times $90 per both therapies, times 26 treatments a year. This results in $117,000 is awarded for the need for future care. Now, this example shows only one of the 4 injury award categories and how our medical team documents the top 5 major financial value driver categories to support your injury claim for a policy limit award. We have now covered the doctor's documentation necessary to support all 4 injury award categories and demand policy limits for a soft tissue spinal injury. And remember, those injury award categories are all the diagnostic and treatment category, the impairment rating category, the pain and suffering category, and the need for future care category. After supporting the soft tissue spinal injury, we now move our attention to defending the 2 most common attacks from the insurance company. There are 2 primary strategies the insurance company will use to minimize their financial responsibility and reduce your injury award. The 2 common insurance arguments are the injury was pre-existing and it was a low-impact injury with little property damage. This is a simplified version of how our 5-step method works to defend the pre-existing injury argument. We would list all similar pre-existing injuries. We would quantify all the pre-existing injuries. Then we would list all the new injuries, and then we would quantify all the new injuries. And we would subtract the previous injuries from the new injuries. As an example, if a patient had a pre-existing injury with an impairment rating of, say, 5 whole body, and a new injury impairment rating of 20 whole body, we would apportion the new injury at 15 whole body impairment, or 75% responsible. Now let's turn our attention to how we defend against the low impact injury with low property damage argument. Now, the insurance company will typically cite low delta velocity and show minimal car damage pictures to support their argument. Delta velocity is only one of 9 factors which determine the extent of an injury. We support low-impact injuries by documenting all 9 potential injury factors. The following are the 8 additional factors we document to counter and minimize the low-impact injury and low property damage argument. These are the 8 additional factors that will magnify an injury. Were there defenses up? Were the joints locked out? Was there a whiplash effect? Was the headrest up? What was the car weight differential? What was the car safety ratings? What were the surface conditions? And were the vehicles moving? The goal is to acknowledge and minimize the low delta velocity argument while showing documentation for the other 8 factors. Documenting the additional 8 factors minimizes the low delta velocity argument while justifying the low impact injury with low property damage. Then we support our low impact injury argument by including all 9 factors and relating them to the story of General George Patton's death. General Patton was in a low impact injury that broke his neck, which resulted in his death, while the driver and passenger survived with little more than scratches. If delta velocity were the only argument to determine the magnitude of an injury, then General Patton would not have broke his neck and died as a result of his injury. Concluding there are 9 factors that determine an injury, not just delta velocity in pictures. Now let's turn our attention to how to stop lowball offers. Here are the facts. Insurance companies keep data on your injury claim acceptance. Consistently accepting lowball offers results in more lowball offers. Insurance companies know when you lack the documentation to take the case to trial and win. Documentation lacking the financial drivers will perpetuate more lowball offers. The number one way to stop lowball offers includes the willingness to periodically bypass the insurance adjuster's lowball offer and present the case to a jury using our medical team documentation and testimony. The best cases we suggest you take to trial have 5 characteristics. It starts with the insurance adjuster's lowball offer, and let's say the patient has no pre-existing injury, and we can document the patient's AOMSI injury, and we have positive loss of enjoyment of lifetime activities, and we document positive duties under duress restrictions. In those 5 combinations exist, if those 5 combinations exist, you may seriously want to consider bypassing the lowball offer and use our documentation and testimony to win a large jury award. This now brings us to the steps and documentation necessary to win a policy limit award for the soft tissue spinal injury. Winning a policy limit award and stopping lowball offers starts with our medical team's knowledge and documentation of the top 5 financial driver categories for the soft tissue spinal injury AOMSI. When we apply the 4 pillars of personal injury case management, which are show the cause and effect relationship, tell the story using subjective and objective documentation, include the AMA impairment ratings, and establish the need for future care. Then we add the documentation necessary to defeat the insurance attorney's attack on the pre-existing injury and the low-impact injury with low property damage. The last piece of the puzzle to win a policy limit award and stop lowball offers is to use our medical team's narratives to support your injury claim, or if necessary, our testimony in a jury trial. Using our medical team's documentation, you will now have support for all 4 injury award categories to demand and win a policy limit award for soft tissue spinal injuries. Over the years, we have experienced attorneys who do not have a doctor who understands how to document all the financial drivers of the soft tissue spinal injury or testify in court. These are the categories your client's doctors will need to document to support your injury claim. The top 5 financial driver categories, the 4 pillars of case management, how to defend the pre-existing and low-impact injury, then convert the documentation into the 4 major injury award categories. If your client's doctors do not document those categories, you should be ready to continually accept lowball offers, lose thousands of dollars per case, depending on your case volume, lose hundreds of thousands of dollars per year, and even possibly millions of dollars over a career. And so the question becomes, how much longer will you be willing to lose money based on a doctor's lack of documentation for the single largest injury by volume, which is the soft tissue spinal injury? Allow me to suggest the next step and show you our financial claims worksheet that shows the exact steps necessary to win a policy limit award for soft tissue spinal injuries. These are the 4 injury award categories in which the doctor's documentation has a direct impact. All the medical diagnostics and treatment category, the pain and suffering category, permanent injury and impairment rating category, and the need for future care category. Our medical team has developed a financial claim worksheet which shows how our documentation is converted into each of the 4 injury award categories. The financial claim worksheet uses industry standard medical legal payment formulas to show the exact steps necessary to support your soft tissue spinal injury claim for a policy limit award. Give me a call and we will review how our financial claim worksheet converts our financial driver documentation into all 4 injury award categories. The strategy to winning a policy limit award for soft tissue spinal injury is to add all 4 injury award categories and not just one. Give me a call to review how our financial claim worksheet will convert the documentation into policy limit awards and stop losing hundreds of thousands of dollars a year by accepting lowball offers.